Lydia, I think, says 4 years of self-treating neurocysticercosis, someone, which is a parasitic infection in the brain. Someone gifted me an aluminum water pitcher to drink my mineral water from. I mean, this doesn't sound good to me. Aluminum is a neurotoxin. I'm studying benefits of aluminum. I don't know. I've never heard of that. And water produce hydrogen that removes free radicals. Okay, so there's been a lot of lies told to people to never use aluminum foil or cookware. I am starting to believe that the opposite is true since hydrogen eradicates parasitic infections. So there's a lot of things that will eradicate parasitic infections, and it's not necessarily something that'll be good to do in your body. Aluminum is poison, but all the beer and drinks in aluminum cans are very safe. Thank you. So yeah. Yeah, so all the beer and drinks in aluminum cans, I don't think are safe. I think that they're unsafe. And, they're actually, you may be getting more BPA from them because they're lined with plastic than you are aluminum from those cans. So that's another issue. So, you don't think you're escaping the plastic by buying an aluminum can for your water or for whatever. You're still being exposed to the plastic liner. If you buy canned food, again, it's like lined in plastic. It's not, you have probably more plastic that you're being exposed to than aluminum from the aluminum stuff, except for the stuff you're cooking from, so aluminum cookware. So we're primarily having a plastic problem with all this packaging, whether it looks like plastic or not to us. But yeah, you can definitely fix neurocysticercosis without, so you can use things like chemotherapy that hurt you and the cancer, or you can use things that just hurt the cancer primarily, with a little bit of collateral damage in your own body, which is not so bad that it's going to lead to a severe problem later. It'll just heal itself. And so the same with parasites, you can use something toxic to you and the parasite, which I wouldn't recommend, or you can use something that's just toxic to the parasite, which I would recommend. And if it's in the brain, I mean, if it's really neurocysticercosis, then you got to be careful, right? You don't want to create a tremendous amount of inflammation from killing it off suddenly, So there are some things that have to be done very, very delicately, carefully. You wouldn't want to take super high dose of, a drug that kills a parasite if it's lodged in your brain, because you could cause damage to your own brain from the inflammation. So there will be some situations where you need to tread very lightly and go very slowly and kind of coax the thing out. So again, not an easy situation. I would seriously consider going to Hakeem Shabazz for this if you definitely have this problem. Bronia says, I believe my histamine issues got a lot worse after COVID. Are there medication or supplements to get rid of the spike protein that are not high in histamine? I know nattokinase and ascorbic acid are fermented. Would getting rid of the spike protein help balance your immune system? I'm taking LDN, quercetin, zinc, vitamin D, Zyrtec, Pepsid. Okay, so yeah, getting rid of the spike protein will help. Again, so people need to understand that they probably are dealing with just the tip of the iceberg with spike protein. The spike protein came along and caused a lot of problems, but it usually required some sort of iceberg to land atop of, so the straw that broke the camel's back is just the last straw. So the spike protein for most people is the last straw, and there's a lot of other straws to deal with. So even though something's fermented, it's purified, so there's very little, chance that there's going to be histamine in it. So I wouldn't worry too much about, and histamine, getting exposed to histamine from nattokinase. I would try it and see. If you don't have a reaction to it, I think you're fine. So you can try nattokinase, serrapeptase, bromelain is another one, and EGCG is another one, and fulvic and humic acid are some other ones that are in our detox spike buster at least. Ivermectin helps certainly to get rid of the spike protein, but So again, so things can look one way and they can mean different things in different people. So in one person, your symptoms might be, a good sign that your body is getting rid of the problem, and you need to just help the body along, help it to do that, and not suppress the symptoms. So, or not specifically try to suppress them, right? Like, we try to keep you as comfortable as possible. So we try to walk a fine line between like getting rid of the problem and keeping you comfortable at the same time. So it is possible to do that, somewhat, but there will be periods where you feel a lot worse. And the other thing you can try is chlorine dioxide. So that's certainly not high in histamine. So it's another thing that you can try. It creates a lot of oxygen, so it creates these oxygen bursts, just like your immune system does, to kill and destroy damaged cells and get rid of toxins and parasites and viruses and other infections. So, I mean, we just need more information. I can't give you a diagnosis and a treatment plan based on just a few sentences. So I'm not 100% sure what's going on. Lisa says, is there a test that can show whether an illness that someone had several months ago was in fact COVID? Recently, this person, 2 months after recovering, took the LabCorp SARS-CoV-2 semi-quantitative antibody spike test, and the result was level below the detectable limit. Would this test have shown if it were COVID, or is there a better test to check? I mean, you could check things, but there's nothing that's going to tell you for sure. Because if any of the tests are positive, it could indicate a test that happened before 2 months ago, So treatment with your COVID protocol via my GoToDoc prescriptions was initiated. Symptoms were like a bad bronchitis. I'm wondering if it was in fact COVID. I mean, you can know whether, there's no 100% accurate test, right? So there are tests like the T-cell test. They'll show T-cell immunity. And you can get these antibody tests that will show that you likely had a previous infection with COVID-19, but they don't tell you when you had the infection. And even if they're negative, it doesn't mean you didn't have an infection. So some people, the test will come back negative, and it doesn't mean that they didn't have an infection. It might just mean that their immune system isn't, overactive, and the B cells still remember COVID, but they're not pumping out so many antibodies that the test, pops up positive. Or for some reason, the B cells just aren't active enough. They should be more active. They should be making at least some antibodies 2 months later. So there could be an immune problem where the B cells aren't making antibodies, and the T cells do show the memory. So yeah, you can get the T cell test. I'm not sure how to order it or where to get it from. That it made the news, a few years ago when they first came out with it. Alinda says, I already still had issues from my first infection with COVID from 2021. I just got it again 2 weeks ago, and I tried going back to work. I became dizzy with high blood pressure. I'm having POTS symptoms, and my heart feels like it's bouncing all over the place. I took hydroxychloroquine and the first-line supplement protocol. My doctor just keeps wanting me to go to the ER instead of seeing me in the office. I went yesterday, and they treated me so badly, I don't want to go back. Any suggestions on what I should do? Being up walking around doesn't feel good. If you can, take some time off, sit in the sun, bask in the sun, sleep well, turn the lights off after dark, just do some supportive care for a little while. It's only been 2 weeks, so I think that you might just need to take a break and give yourself a little bit of time. Do breath work, and just take it easy for a little while, and maybe go really low carb. That can sometimes be really helpful, and give your body, just give yourself a minute, to deal with the thing. There's going to be inflammation for weeks after a COVID infection, and if you're under a lot of stress, then that will worsen the inflammation and not give your body a chance to get rid of the problem. So you can take the detox spike buster and the immunity herbals and eat an anti-inflammatory diet and try to de-stress and take some care of yourself for a little while, maybe take a little time off. And if you do that, usually you can bounce back and come back a lot stronger later, instead of if you try to force it, that's when people sometimes get sick, when they don't get to give themselves a chance to just take a little while to recover. Christina says, I was diagnosed with ground glass opacities immediately after having COVID. Can this cause cancer? So severe cellular stress can cause cancer, right? So, but there's no clear direct connection between ground glass opacities and cancer, so that I know of at least. So ground glass opacities, I mean, it's not, the thing that comes to mind is not cancer after that. So you had some inflammation, but it'll usually go away, right? So but there's a delay, right? So if you wait a few months and you recheck your lungs, they should be cleared up and you shouldn't have any problem and you shouldn't have cancer. So just the COVID infection, especially without any vaccines or anything like that, ground glass opacities, again, your body, your immune system just took it really seriously and it took it out, and there was some damage, some damage in the lungs due to the body taking care of the problem. And the lungs can recover and they can fully recover, and they probably will. So I wouldn't be worried about it. All right, everyone. Yeah, Shane says I went to 0 on the Seroquel in under 2 weeks. So yeah, that's pretty fast. Probably would have been easier to taper off, but I think you're doing pretty well at this point. Now that you've stopped it, it's just going to take a little time. If I were you, I probably wouldn't start it again, trying to taper off slower. I would just live with it and put up with it, and see how it goes. All right, everyone. Thank you for watching. Like, subscribe, retweet, etc. And I'll see you guys next time. Bye-bye.